So what I am going to talk about will be the introduction of Meridian and key acupoints and the importance of body relaxation and demonstration. Also, I will do an introduction to gua sha, the theories, equipment, precautions, maintenance, and some things that we need to be careful of while doing gua sha. Also, we will also teach you how to do shiatsu techniques, demonstration, and introduction to lymphatic draining massage. So first, I would like to teach you about meridians. So there are 12 meridians altogether, and the Ren, Du meridians. So the main two things we're going to talk about is the bladder meridian and the governor vessel. Because today we are going to do gua sha on the bladder meridian and the governor vessel. So why are we talking about the bladder meridian? So what does that mean? It means detox. So the main thing about it is about getting rid of toxins. So when we are having a heat strike, we will be able to detox through the bladder meridian. So the bladder meridian, I'm going to talk about its distribution. The very start of the bladder meridian is at the inner corner of the eye. It is called the Jingming acupoint. It will cross the forehead and reach the top of the head. And from the head, there will be a branch that also connects to the brain. And then the main meridian will go from the top of the head to the soles of the feet. So with the two brains that goes from the top, they will go separately, and they will also merge at the back of the thigh and the back of the knee, going around the lateral, along the back of the calf. And then the merged meridian then flows the outside of the foot to the tip of the toe, and is under the little toe, and it is ending at the Ziyin acupoint. So that is, you can see where the bladder meridian is going. So you can pay attention to what it looks like, and it will be a lot of help for you. The next one is governor vessel distribution. So today we're going to only talk about the governor vessel. And you can go check online and you can look at the Ren vessel. This one is very important because we're going to gua sha on the governor vessel today. So it starts at the Changjiang acupoint at the end of the tail vertebrae. It is going to end at the Zhenzhong acupoint. So basically, it starts at the back, at the end of the tail vertebrae from Changjiang, going all the way to the middle of the Dazhui acupoint, and going up across the Baihui acupoint, and then going down all the way to Zhenzhong acupoint. So it starts at Changjiang and ends at Zhenzhong. So next, we're going to introduce some of the important acupoints. So why are we talking about the important acupoints? Because when we're doing gua sha, these important acupoints will help our circulation, and sometimes if you have some disease, they will actually stay at these acupoints. If you can allow these acupoints to become stronger in the future when you're doing detoxation for your customers, it will work even better. The first one is the Dazhui. When we lower our head, the depression under the bulge of the bone where the neck and back connect is where the Dazhui acupoint lies. So if you don't know where it is, you just lower your head and you feel the back, you'll feel a part that's coming out. So that's where the Dazhui. That is where the 7th neck vertebrae and the 1st chest vertebrae actually, first thoracic spinous vertebrae actually meets. So what it does, it can actually allow some of the heat to go. Or for instance, if you have tonsillitis or other disease, you can use the Dazhui to take care of it. The second one is Fengzhi acupoint. The reason we talk about Fengzhi acupoint, the main phenomenon, it will help you relax your entire face. So anything to do with the face, for instance, stuffy nose, headache, dizziness, runny nose, or even a tightness on the neck, or sleeplessness, you can massage your feng shui acupoint. So later, when we're doing the gua sha, we will also go through the feng shui acupoint. It is also a very important acupoint for massage. So for instance, if you are having problems sleeping, you can massage the feng shui acupoint. So the way we're going to actually try to massage it, you can use the thumb of both hands to be buckled on both sides of the head. The depression you can feel while sliding your hand along the hairline is the feng shui point. So you can't do it perpendicular to your bone. You have to actually do it parallel. You can't just press it straight down. Maybe you'll be able to press down on some sore points, but it won't be at the feng shui acupoint. The next one we're going to talk about is fei shui acupoint. So we see the name, we know it has to do with the lungs. It is mainly to get rid of waste, and then breathing and anything that has to be your airways. So it is located below the third thoracic vertebrae, and it is about 2 fingers wide next to it. If you don't know, you can look at the picture, second image right here. You can see where the fei shui acupoint is. It's basically where T3 vertebrae is. So it is on both sides, about 2 fingers wide. Because we talked about the bladder meridian, when you go around, there's 2 fei shui acupoint next to it. Next, we're going to talk about especially significant acupoints. The main important one is called the Gao Huang point. There's a saying called when the sickness has reached your Gao Huang in the Chinese medicine. It is located on the inner side of the back scapulus, about 4 fingers width from the thoracic vertebrae, T4. It is a very important acupoint because the most outside of it, it has muscles to go around it, and it is actually protected by these muscles. So basically, when you're turning your head around, you will be you'll be moving these muscles. So if you can effectively try to relax this point, it will actually help relax your shoulder, your back, your neck. If you sit around for a long time or you have a very bad stomachache, you can press these 2 acupoints and do a lot of relief. So that's why it is a very important acupoint. So next, we're going to talk about the importance of the full body relaxation. Well, no matter it is from a mental or physical point, if your body is overly tired, then your body will be very, very tight. So it prevents the beautician from relieving the customer's deeper muscles, no matter how hard they're pressing on it. Sometimes they'll use 2 or 3 times the amount of pressure, and you still can't reach a point that you want to get to. So sometimes if your pain is based on a much deeper muscle, it may be actually causing you more trouble. So therefore, before massaging or gua sha, we need help the customer relax their muscles through stretching or massage, and then we can be able to massage their deeper muscles. Because otherwise, if your muscle is very tense, when you press on it, there's actually not much you can do. At the same time, after they're relaxed, if you want to perform gua sha or stretch or do a little bit more beauty routine, if you can help them relax, then it will actually help you work much better. Also, traditional Chinese medicine pays attention to the smooth running of your energy and blood. So if you can effectively relax the muscles, it'll allow your inner energy and blood to run smoothly, and it will allow the customer to get better gua sha and gain relief easier. So later, I will also teach you how to use shiatsu or relax your whole body. I will demonstrate for you. The first step, I'm going to let the customer lie down facing up. I'm going to use a towel to cover their neck and shoulders. And you can use your hand or your thumbs to allow them to relax. And then you're going to massage their upper back with your hand. That's where the bladder meridian is. Based on the muscle, that is one of the longest muscle in your body. It is also very important because it wraps around your vertebrae. So you use your hand to try to help them relax the upper back muscle. Once they are able to relax the muscle, then you can use a hand to massage the Fengshi acupoint. And so they can relax their shoulder and neck. You can go back and forth a few times and relax it slowly and don't use too much strength. Because if you use too much strength, the customer will tense up and it will start to hurt. So you need to actually do it very lightly, slowly, and help them relax. So when you are pressing on the acupoint, you will feel it's a little bit sore. It is not going to be a severe pain, but it is going to be a very comfortable sore. If they are in a lot of pain after you press on it, that means you've pressed the wrong point. Also, you will rub on the dajue point. If you touch it and it's a little bit cold, that means right now they may be having a cold or under the weather. So if you press on the dajue point and you press it when they have a cold, they'll feel very uncomfortable. And you can kind of try to warm it up and it'll allow them to relax and they'll feel better. And you'll also relax their neck and shoulders. After they're more relaxed, then you try helping them relax their shoulder. And you place emphasis on relaxation of the scapular muscles. We will show you where the muscle is later on when we're demonstrating. After that, then we will relax the pectoralis major muscles, because we want to place an emphasis on relaxation of the sternocleidomastoid muscle. It'll help actually relax your chest muscles very effectively. So once you actually relax that, the customer will feel even more relaxed when you are performing the gua sha. After the relaxation, you can try to relax the pectoral muscle and you move it back to the other muscles. After it's relaxed, if you feel like, well, it seems like their neck is a little bit tighter, you can press on the tight points a little bit and kind of press down a little bit to help them relieve it early. It helps them relax their neck. After they're relaxed, then you can do the demonstration of a full body relaxation. So next, I'm going to talk about the gua sha theory. So some people may ask, what is the theory of gua sha? So blood circulation is like a large river, and because about 70% of our body is water, so the blood flow is like a big river with a lot of diverging pathways. When something in our body are out of balance, the energy and blood stagnation occurs within the body. It would actually get stuck. So at the same time, if the body cannot adjust to the changes of the external temperatures, then your body will show symptoms such as fever, chills, or heat stroke, or even sometimes you'll get afraid of cold, or stiffness or soreness. So gua sha destroys the capillaries on the surface on the skin, and it will result a slight inflammation. Once you have a slight inflammation, your muscle will soften a little bit, and it will also get rid of heat, through increasing local blood circulation. So for instance, sometimes after exercise, you have accumulated lactic acid or tissue metabolites will be metabolized due to the accelerated circulations. So this way, all the waste and some toxins will be carried out of your body. Also, through dissipating the heat, your body will be not so hot, and you will be able to regulate the body temperature, and the body repairs itself through elevated metabolism levels. So then, if you're having a cold or you're having a heat stroke, usually it can help you relieve the symptoms. And also, it will also get rid of the hidden toxins in your body. And that is why the bladder meridian is so important, because the bladder meridian actually takes care of all the waste excretion. And for instance, emptying your bladder, getting rid of urine. So if you you can use gua sha to allow you to get some sweat, it will actually help get rid of all the toxin in your body. So what is gua sha? Gua sha, it is similar to what I said, and in Western medicine, it is actually a heat disorder. But in Chinese medicine, it is considered a stagnation caused by the yin and the yang imbalance. So which means all the sha, it is a toxic substance that is accumulated on the surface on the body. So to put it more simply, when internal organs or systems malfunction and make the body unable to normally absorb nutrients or eliminate waste, the sha accumulate in your corresponding internal organs. And this is why we will say it is an imbalance of the yin and the yang. Because sometimes, for instance, when you're having a cold, if you have a cold medicine and if you have a heat stroke, you also take cold medicine because they're both symptoms. So when we're doing gua sha, it will be a difference. So when you have a heat stroke, there's a yin heat and a yang heat. So, but they can both be gotten rid of through gua sha. So when things are starting to become stagnant in your body, the circulation starts to become really bad, and the toxins will start to build up, and then your body will start to have corresponding disease, which can cause different disease up to even cancer. So if we can do gua sha and we can improve the circulation and the regulation of bodily temperature based on the temperature outside. And also, sometimes you have really bad insomnia. So what do we do now? So right now, you need to get rid of the sha that is built up on the surface and get rid of it through gua sha. So this way you can improve blood circulation and promote body recovery and regulation of body temperatures. So this is what will happen after we do gua sha. We can prevent the bigger disease through using gua sha to get rid of a smaller disease like a fever or a cold. So in the picture, these are different equipments that you can use for gua sha. It's all really based on how you're going to use it, because you can perform gua sha on something besides the back as well, but we're only going to talk about the back today. So there are a lot of different places. For instance, our neck, our shoulder, and our back, our middle back, our lower back can all be performed. Even our chest and our stomach can be done with gua sha. That's why they have different tools for them. And in all reality, with the tools, all you have to do is choose something that you find suitable and something that your customer are not against. So really, gua sha is just a technique, and you can use any tool to perform the gua sha. Okay, so there are some precautions and some taboo for gua sha as well. So what do you have to be careful with? First one is elderly people, because sometimes for elderly people, if they have bad metabolism, if you do too much or not enough, it will actually interfere with their blood circulation. It would actually make them more uncomfortable. So for the elderly people, no, not only do you have to do it lighter, it still has to be at the right place. Or people with heart disease. Because when you're doing gua sha, it's actually promoting blood circulation. And if you're making it go way too fast and the heart is going too fast, if your heart can handle it, it can actually cause some problem. The next one is diabetes. Why do we mention diabetes specifically? Well, because a lot of times their lower extremities have bad circulations and they can cause swellingness. So if you didn't do it well enough or not deep enough, that would actually add the buildup on top. It would actually build up more water retention. And also for high blood pressure, and if you do gua sha too hard, it may actually cause their blood pressure to go even higher and actually cause a stroke. Also anemia. Well, with gua sha, it is actually a way of getting rid of waste. If you're excreting too much waste, or if they already have anemia and they're already quite weak and they're hungry, actually, they don't have the strength to actually fight off the gua sha. When we're doing gua sha, all we're doing is trying to promote blood circulation. But the blood circulation can go up and have a bigger or better metabolism. But this is not something I give you. I'm just helping you promote it better through gua sha. We're just causing a mild inflammation and promote circulation. So once the metabolism is up, you will recover yourself. But if you're weak, or you're too hungry, or you're deficient in energy, or you're sleep deprived, you don't have the strength to fight the inflammation or to recover. So if you're deficient in energy or hungry or sleep deprived, remember, don't do too much gua sha. You still need to check their reaction. Also, pregnant. So for expecting mother, if you do too much and they're afraid and it causes a miscarriage, or if you do too much, and sometimes they will have diabetes during pregnancy, and you have to check on how their wounds are recovering. Also, you need to be careful with their injury and skin disease, because especially or like even half an hour after a meal, because all the blood is at the stomach. If you still perform the gua sha, it will make them very uncomfortable because it would tip off the balance of their body. Also, the next ones we're going to talk about are taboos. The people who have broken bones, if you want to promote the blood circulation, if they already have a broken bones, or they have cancer already, or malignant tumors, when you're trying to perform gua sha on them, if you're allowing their blood to circulate more, wouldn't you be helping the cancer cells spread through promoting the circulation? Or with infectious skin disease or AIDS or STDs even, because that will also be bad for yourself. Also, severe anemia, because if they're already low on blood, if you accidentally hurt them and cause them to bleed, it would be actually bad. Or severe heart disease and severe diabetic patients, you cannot perform gua sha on them, because if their heart couldn't handle the gua sha and their heart rate increase, they may pass away, and it would be very bad. So why do I specifically mention severe diabetic patients? Well, because for the severe diabetic patients, when they're hurt, their skin would actually go bad very easily. So please avoid performing gua sha on them. So what we have mentioned earlier, the taboos and precautions, we need to make sure we pay attention to them. Then we're going to talk about the advantages and disadvantages of gua sha. So we talk about the advantage of gua sha. So it will strengthen metabolism in different parts of your body, and you can reduce lactic acid buildup and tissue metabolize accumulation. So for instance, usually when you're exercising, lactic acid will be created, and if you stop all of a sudden, or you have not exercised on a regular basis, there will be an accumulation of lactic acid, and it will become soreness. And also, the tissue metabolites accumulation. When your body tissue are working, there are some things that actually work. So you can actually help metabolize it through gua sha. It will destroy inelastic or stiff capillaries, and this way you will allow new capillaries to regenerate. So for instance, if your capillaries are already stiff, then you will definitely have bad circulation. So through gua sha, by breaking up the stiff capillaries, then you'll have new capillaries. Then you'll have better capillaries. The third one is you'll allow your muscles in your body to relax, because through the inflammatory reaction, your body will relax and you'll have better circulation, and it will allow your muscles to loosen up. Also, it would also cure the fever or heat stroke or cold through the imbalance of the body temperature outside. So for instance, in the hot summer day or in an air-conditioned room, you need to use the gua sha to actually promote the balance. But make sure you don't perform gua sha in an air-conditioned room, because sometimes it will cause your muscles to tighten up, and that would be actually bad. Also, it will accelerate detoxification of your entire body and promote metabolism. The disadvantage of gua sha, first one is it'll cause a certain degree of damage to your skin. And also it can leave bruises on the skin because it is actually breaking the capillaries. It would actually leave a lot of bruises, and for some girls who like to be pretty, they may not want to do that. Also, frequent gua sha treatment can cause the skin to become very rough. So do not depend on gua sha too much, because if you do it too much, your skin will become very rough. So after gua sha, we need to do some type of maintenance. So if you still continue to drink ice water and continue to stay up late after gua sha and do things you're not supposed to do, of course your body will become worse, and you may even faint. Because, for instance, I had a patient before. He still go and play mahjong over like very late until night, and then he threw up the next day and he had to go to the hospital. So how do you maintain yourself after gua sha? First of all, you need to drink a cup of warm water after gua sha, not hot water. Some people have the misunderstanding that you must drink hot water after a massage, but it's actually wrong. Water will be fine. Also, a lot of people are trying to think, are you supposed to drink cold water or warm water when you're exercising? After exercise, you're supposed to drink cold water, and then after gua sha, you should drink warm water. So don't think that you should drink hot water no matter what. So make sure you drink cold water after exercising and drink warm water after gua sha. And also, it is normal to feel pain in the scraped areas about 2 to 3 days afterwards, even a little bit of redness and soreness or swollenness. So, if it doesn't go away in a few days, it means your metabolism is not very good. So the more you do it, it would actually recover even faster. Also, make sure you wipe off your sweat immediately, because otherwise you would actually catch a cold and it would make your body worse. So make sure if you're sweating, make sure you wipe it off straight away. Also, try to refrain from eating sour, spicy, greasy, or hard to digest food. It would actually cause bloating and have bad effects on your metabolism. So we're going to talk about the gua sha techniques. We're going to explain to you how to do the gua sha techniques. So you can do however you want to, but make sure you remember what I teach you. First of all, you should always conduct it in a single direction, from inside to outside, from top to bottom. You can never do it from outside to inside and from bottom to the top. If you don't do that, then all the meridians will be messed up and your effectiveness will become way worse. So make sure you always do it from the inside toward the outside and from the top toward the bottom. The scraping board should always be held at a 90-degree angle toward your body, and only use it lightly on your skin. Don't do it very hard, because if you scrape it very hard, it'll be very uncomfortable for the person, and they will tense up very bad. So if you have already helped them relax and they tense up again, and it would be even harder for you to perform the gua sha. So make sure you do it lightly instead of hard. And last one, gua sha should always be conducted slowly and gently without force. You can even make them fall asleep. Make sure you're doing it slow and gentle. Do not force it, because if you use too much force, they will tense up. Once they're tensed up, all your relaxation have become a waste. So make sure you do it lightly. So when you're doing gua sha, always conduct in a single direction, from the inside out, from top to bottom, and the board should be held at 90 degrees to the body, and do it lightly and gently and slowly. So the parts that you're going to do gua sha and massage, today we're going to talk mainly about upper back, your neck, and the top of your back, your upper back. And we're not going to talk too much about the middle part. If you're interested, then you can look at the lessons later on. So where we are going to perform it, it would be the different muscles on your neck, and going down, there's also the muscles right around your spine, and lower, you'll go deeper into the middle part. But the middle part is part of your diamond-shaped muscle. It'll be very close to your Gao Huang and Fei Chu acupuncture point. So you need to pay more attention to it and even scrape it few more times. Also, we're going to talk about the front, your pec muscle, and the other muscles under your collarbones. These are all things you need to pay attention to because when your neck are turning, you will be feeling this muscle right here and even your pectoral muscles. So you need to make sure you relax these muscles and even your back or the front. One is yin, one is yang, one is front, one's back. So you need to do both and it will have a better effect. Also, we also need to talk about levator scapular muscle. This is one of the very important muscle. It's the most important muscle. So if you do everything else lightly and very shallow, it's okay because at least you're relaxed. But if you've actually worked on the levator scapular muscle, you need to actually work it more because it is a very deep muscle and it will be very effective. So it is connected from the first to fourth vertebrae of your cervical spine down to the medial upper of the scapula. So, for instance, when you are sitting in your office or looking at your phone or picking something up, no matter what you're doing, you would almost always use this levator scapular muscle, and it's a very deep muscle. So you need to make sure you relax this muscle properly. In other words, it goes from the first to fourth vertebrae of the cervical spine, and it goes down to the medial upper of the scapula. So next, I am going to talk to you about the full body relaxation and the gua sha demonstration. So when you're doing gua sha, it'll be the scraping the neck and your upper back. There'll be 3 lines. The first line, it'll be the occipital depression down the spine, the governor vessel. And so the way you do this is to get rid of heat. So if you have tonsillitis or you have neck discomfort, you can do this. The first line go from the occipital depression down the spine, from this way, going down your neck. And you know the government vessel. It goes up all the way to your renzhong, acupoint. So you can see where the depression is, and going down, it will be the dazhui, acupoint. So when you're doing gua sha down, and then do it up lightly, and it will become a medium point to the middle of the 2 shoulder blades. That's your upper back. The second line is going to from the high bone behind your ear, on your left ear, along the left side of the neck, to the midpoint of the line connecting the inner part of the left shoulder blade and spine. So it will be parallel to the first line. So the first point is going to be from ear to the high bone, and then the next is going to be a line halfway parallel from the first line. The third line is going to be from the high bone behind the right ear and along the right side of the neck to the midpoint of the line connecting the inner part of the right shoulder blade and spine. It will be parallel to the first and second lines. So why are these important? Because these will actually include the 2 important acupoints. One is a Fei Shu point, the other is a Gao Huang point. And the first one is the dazhui. So this is a demonstration of gua sha. These are some pictures, and you can look at them and use them for reference. So next, we are going to do a shiazi demonstration. When we're doing shiazi demonstration, we'll start from the left side of the body. Because the human body's circulation is from the left to the right. Our heart is on the left side. So when we're doing it, we'll allow the customer lie down facing up and with their face to the right. So when we do that, it will actually show the sternocleidomastoid muscle. So use your thumb clockwise lightly to the upper edge of the pectoralis major muscle. So make sure you're trying to release and loosen it. So you have to do it light and gently, not too hard. So because like I said earlier, if you do it too hard, they will tense up again. And once they tense up, all your relaxation has gone to waste. So make sure it's light and gentle. It may be a little sore, but they may even fall asleep. They have to go from here, go all to the top of upper edge of the pectoralis major muscle. When you press here and you turn your neck, you will know it is actually connected to the turning of your neck. So, if you can relax here, your entire front part of your neck can actually get some relief. Therefore, the face has to be facing the right side, and you'll be able to see this muscle, sternocleidomastoid muscle. You can only do it lightly, not hard. If you think it's okay, you can also do it from light to hard, but not too hard, because it is very close to your main arteries. If you're actually pressing on their artery or their airway, they will actually be very angry and argue with you because it's very uncomfortable. So next one, you want to use your hand or the tip of your finger to massage, or like the middle part of your thumb or the bone part of your thumb. It can all help relax, but make sure you don't allow them to become very tense. The next one will be the pectoralis major muscle, to go from the inside to the outside. So when you're doing that, it's like trying to release the qi smoothly outside. So do it lightly from inside toward the outside. And then start from the clavicle muscle, lower 1, 2, 3 lines. So just press it lightly. You'll feel something a little bit hard. Usually, that is a knot. So you want to actually press it lightly. You can start 2 to 3 seconds when you're doing it. There are 3 lines because this is smaller to your delts. So it's also very important for you to relax those muscles too. So 1, 2, 3 lines. You can see there are 9 points altogether. And then press them slowly. Press them lightly. 1, 2, 3. 1, 2, 3. 1, 2, 3. You can do it like that. And once you press it like that, you'll realize, well, when they're laying down, it may be a little bit tight when they're laying down. But once you press it a few times, you'll see that they'll start to relax. The next one, once they're done relaxing, you can try to help your hand to relax a little bit. So after you do that, their left pectoral muscle, it'll actually help. Next, you can do massage the groove on the rib close to the neck. It's called Tian Tu Acupoint. I didn't teach you so much because you need a little bit of time to digest it, but that's called the Tian Tu. And you need to go clockwise, lightly, because when you're doing it clockwise, you're trying to release it. And there will be a knot a lot sometimes close to the Tianshu, because that's where you will actually feel it when you have mucus in your throat, or if you're not feeling very good, or your throat is actually swollen. This spot will be a little bit swollen, and you can relax it a little bit, and then you can help that circulation right there within smaller points. When you press it lower, it will be at the Tanzhong point. So the Tanzhong is actually in the midline of the 2 nipples. So how do you see them on a female? You can ask them about where they are. Tell them where the Tanzhong is, and they can point it at you. And they can tell you, because otherwise it'll be a bit embarrassing. It is the midline of the 2 nipples. So when you're pressing down on the Tanzhong point, it will be very painful when you press on it. So you want to press on it lightly and slowly. And if you press on it too hard, they will cough, and they would actually tense up. So make sure you do it very lightly. Tell them to take a deep breath and only press it a little bit harder when they're breathing out. Do not do it when they're breathing in, because it will make them cough and it will be killing them instead of helping them. So do it a few extra times. And always do it from the top to bottom and in single direction. Do not do it back and forth, because that wouldn't work. It will be only one direction and going from top to bottom. And then you can use your thumb or middle finger or anything. You can use whichever works the best for you. And then you can change to massaging the other side, the right part of the body. So on the right side, you have to see where the sternocleidomastoid muscle, and use your thumb to work on it, or even your middle finger. And then do it slowly, lightly, and not too hard. Make sure it's always lightly. If you really want to press it hard or deep, you can still do it, but you need to only do it when they're breathing out. But in the beginning, let's not try to do too much of that. So in the beginning, you just want to do it lightly and slowly. Just like this, slowly, lightly. And then if you notice any knots or anything harder, you can try to work on it slower and then try to help work them out. And you can ask your customers how they feel. If they're actually in pain when you're pressing down like that, then stop, because it could be a tumor. But if it's just a little bit sore, then they'll be okay. You continue to do it. And if they're okay, just help them relax, because it's when these points are tight that makes them uncomfortable. So once you help them relax and then rub it a few times, once they're relaxed, you can see their face. You'll see a little bit of differences on their face. That means they have been relaxed. And then you want to use and help them relax the upper edge of the pectoralis major muscle with your hand. So that is the muscle that will also work on when you're turning your neck. So if you can relax this point, it will be extra effective. Also, you always work from the inside toward the outside. You relax it like that. You can use either your middle finger or your thumb, and it'll be based on what you need. So for females, usually they would like it done very lightly. Then you want to do it, help them relax very lightly. And then you can use your thumb, and then you can start from the deltoid muscle. And if you find any sore points, you can press on it and then press on deeper and work with their breathing. Do not press in when they're breathing in, only pressing down when they're breathing out. So if you use a thumb as a distance, you can press it down in 3 lines. That would be a little bit better. So see, 1, 2, 3. You can tell them to breathe in and then breathe out and then press it down. If it's a little sore, but they wouldn't complain. If they start fighting back, that means you're pressing too hard, or you're not relaxing them well enough in the beginning, and that is a big no-no. You need to make sure you communicate with them. And next will be those 3 spots. And then that will be from Tiantu, from the indent under your neck, and then go down to Tanzhong, and it is right between the 2 nipples. And then you go from the left pectoral muscle, work from inside toward the outside to smooth the air out, and then work on the right pectoral muscle. So when you're smoothing it out, it's always going from the inside toward the outside. Never do it from the outside toward the inside. You'll actually get stuck. If you really want more, then you can always smooth it all the way to your hand. But for right now, we don't need to do that. But if you want to do that, you can also smooth it out. But always do it from the inside toward the outside. Okay, so next, once you're done helping them relax, you want use your finger and help them relax from the back of their neck. So when you're doing that, you can find the muscles on their neck, and you can start working on them section by section, little by little. So just press on it and hold on. So if you find any sore points or any knots on them, then you can tell them to lay down and then use the weight of their head. You don't need to actually use any pressure. Just use the weight of their head and hold on for about 10 to 15 seconds. So you just do that, and then you put it on their feng shi point, and then press it down and pull back for about 5 to 10 seconds. If they're feeling it's comfortable, you can do it up to 15 seconds, but not for too long. And then you put it back and relax, and then find the sore spot again and press it. You can do it up to 3 times. If they're feeling very relaxed right now, you can do it a few extra times, because the main thing about doing this is to help the customer relax. So you don't have to stop right after 3 times. And then use your hand to tap on the Bai Hui point. So we talked about where the Bai Hui point is. It is right up here on top of the brain. So how do you know that's a Bai Hui point? So it is the intersection above the 2 ears. So this is where the 2 ears intersect on the top of your head. So use that as a middle point. Use front, back, left, and right. You can use your hand to tap on it very lightly. So from left to right, from inside toward the eyesight. So when you're gently tapping on the Bai Hui point, and you just have to do this. You can't do it too hard. And then just use the 4 fingers and tap it lightly, not hard, not solid. So you need to do it very lightly in the beginning. You can't just like bam, 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 because you'll scare your customers. So you have to tap it very lightly. First, you have to tap on the Bai Hui, and then from the left all the way to the bottom, and then to the right, and then to the front, and then to the back. And when you're doing this very lightly, and you can tap it a few extra times, it's just to help relaxation. Okay, so when you're done with that, next, you want to use your hand to feel like you're almost grabbing their head and massage their head. And you can place the emphasis on trying to focus on the Bai Hui. And then press it. And then move it outwards, smooth it out. And then you can do light, heavy, heavy. Use that tempo to press it down. So when they're doing that, when they're laying down, focus on the feng shi point a little bit more. So light, medium, mid, heavy. Light, medium, heavy. So after these 3, and then start pulling back. So that will be a simple shiatsu demonstration. So this will be all our lesson explanation right here. Thank you. So now we're going to use our alcohol and massage oil, the gua sha stick, and we also have a few alcoholic cotton swabs. So we'll put the alcohol on the cotton swabs. So in the beginning, we will sanitize our hand. We can use our middle finger and ring finger and then press it up. And then you clean your thumb and then clean it between your fingers, and then also sanitize the back of your hand, the palm of your hand, your wrist. So you have to do the same thing in the back. Okay, so you also want to do it in between their fingers too. And the back of your hand, and then their palm and your wrist. So once you're done, you want to do a little bit of shiatsu, and you can lift it up a little bit. And when you're doing the shiatsu in the beginning, you have to press the upper edge of your pectoral muscle. So you want to pull it to right the top upper edge of the pectoral muscle. So first, we're going to press on the left side first. So when we're going to press on the left side, we're going to ask them to turn right way first. So this is the muscle right here, and you want to move it toward the right, and you can see this one muscle right here. And then you can use your thumb and then to rub it, or use your middle finger, or you can use the ball of your hand to rub it. But make sure you do it very lightly, because if you do it too hard, then they will tense up. And then later on, you will actually try, when you're trying to give them a massage, it will be very hard for you to reach the deeper muscles. So make sure you do it very lightly, and then with the right amount of strength. And you will also ask them if that's a right strength or the right pressure. Make sure you're doing lightly. Also, this is very close to the artery. If you're not sure where the artery is, you can do it when they're turning. You can see where the pulse is, and then you can try to avoid where the artery is. And you'll know where the artery is, and you can avoid it. So try to massage it in a way that's actually working the best for you. And make sure you're doing it clockwise. And that's trying to release pressure. And do it lightly. You can press it a few extra times and allow them to relax a little more. And if you're really not sure, you'll do it, move their head toward the right, and you'll see that muscle better. It'll be more obvious. Do it like this. While you're pressing it, you can also ask them, is this strength okay? If you don't want to ask, then you'll just see their facial expression. Then you can know if that's actually working okay for them. Okay. Next, you can start working downwards. And you can see the pectoral muscle. And you'll see the upper edge, right? So then you can use your thumb or your middle finger and then rub it clockwise. Right here. You want to do it slowly and help them relax. And the same, you don't want to put too much power or strength onto it. Because when you put too much stress onto it and they start to stress out or they start to tense up, it would actually, you'll have to take a lot more effort doing the same thing. You can also try to demonstrate it with your thumb. So you can do it either with your left hand or right hand, whichever works better for you. Or you can use the ball of your hand. So why do we say we need to relax their pectoral muscle? Because you can see that when they're turning their head, their pectoral muscle is actually moving too. So when they're doing that, it would actually help them relax their neck. It was very effective. Because we can see all these details. The more details we pay attention to, the more you can help them relax. And so press it down and relax. So that would be this. Next, we're going to try to work on the deltoids. And we can start pressing here. If you think your deltoid is not obvious enough, you can ask them to do this, and you can see their deltoids very well. Ask them to put their hand over here or on their stomach, based on how they feel. So over here. So use your thumb as a distance, and then do 1, 2, 3. There will be a line. There will be 3 lines. So this is the top edge, and this is also a very important part. You can also use your middle finger, press it down, and then rub it clockwise. Press it clockwise. Press it clockwise. Press it clockwise. So if you can feel it, there's some knots somewhere around, then you can work on it a little bit. Because when you have knots, that means there's a blockage or there's an stagnation. So it may be a point that they're stuck on. We also have this acupoint called Asu. So if they say, yes, if it's a lot of pain or really sore, you can press on it. But if it's a very sharp pain, then don't do that. The next line, the first line is right here. So basically 1 inch, 3 inch for where your thumb is, goes to the middle. In the middle. The middle. The middle. And I realize they have a knot right here, so I will actually press it down here lightly, and then work on it with their breath. Breathe in. Only press on it when they're breathing out. Breathe out. It'll be a little bit sore, but don't press down on it too hard. And then you ask them, is this okay? Okay. Next, we're going to work on the third spot. Like this. And then don't actually try to get hung up on how many points, but just work on the line. So you just work on the knots or wherever they're sore, so you don't have to really get very hung up on how many points you're actually pressing. Like this, press it down. And then breathe in, because I realize there's a knot here, so I want to work on it a little bit more. Breathe out. Press it down slowly. And there will be a sore point right here, and you can help them relax right here really well. So once all these are done, I will show you very quickly with a middle finger. And then you'll show you how to use your thumb or use the ball of your hand. So you can press it down. Press it. So you can do it either way, as long as it actually works well for you. So make sure you're doing it clockwise. 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 Now you realize there's a little bit of sore point right here. Breathe in, breathe out. Clockwise. Clockwise. And then you do this. You can use the ball of your hand as well. And try to help them relax. It really is based on however you want to work on it. And then you need to focus on these points and emphasize on them. And then in the end, all you do is you do this and loosen it up. Loosen it from right here, from the inside toward the outside, and then release it. Rub it from the inside toward the outside, from inside toward the outside, release it. Next, you try to soothe their breath. There is a indentation right here where their hand 2 is. You can see a little indentation right here. And then, no matter what you do, just try to do it clockwise, release it. And then, you'll get to their 膻中 point. 膻中穴就是它的2个乳头的中间的一个中线一个地方。The 膻中 point is the center of their 2 nipples. And you just press it down like this. You can press it however you want to, but recommendation is to just use your finger, because when you're using the ball of your hand to do that, you can accidentally touch their chest, and it's actually not good for us. So you want to do it light and slow. Like this. Light, slow. And then over here, I can realize right around their 10 to point, there's a point right here. It's a knot. So this knot, for instance, if they have lung problem or they have allergies or even they have too much moisture in their body, usually there's a knot right here. And you can focus on it a little bit more right here. And then you can ask them to breathe in. Breathe in through their nose, breathe out through their mouth, and then focus on this part. And then do it clockwise. And then all the way to 膻中, going down. So when you're done with that, kind of pick it a little bit. So soothe out their breath. Always do it in the same direction. Do not do it in more than one direction. Like this. Okay. So once you're done, you want to soothe out their breath from up to down right here. And also you can work on it along with their breath. So breathe in, breathe out. And then you start working on the other side, like right here. This muscle right here. You'll see it pop out as soon as they turn their head. So you can see where their artery is right here, and it's pulsing. You see that? Right here. It's pulsing. So we need to make sure we avoid the artery. Next to the artery is the airway, so you need to avoid these 2 points. So you can really tell where it is very simply. Well, because you know you're pressing on the muscle, so you should really you should really not press down right there. Just press it clockwise. Press it clockwise. Okay, even a little slower. Press it slowly. Relax it slowly. Make sure it's not too hard. Also, because some clients, they have neck pain, like chronic neck pain. You can work on it along with their breathing to help them soothe it. So breathe in. breathe out. And when they're breathing out, press it down. Breathe in. Breathe out. Breathe in. Yes. And then breathe out. Breathe in. Breathe out. So also you can see it's a little bit tough over here. It seems like they have a knot right here. So you can see when I'm pressing this, you can see it's turning red, which means they have a very bad circulation right here for blood circulation. So breathe in. So now I can work harder on this part. Breathe out. Okay. Then use your thumb and demonstrate it again. Or you can press a little bit deeper because this is the second time we're doing it. So you can press it a little bit deeper. So make sure you're not rushing it. You can do it in 3 different strength: light, medium, and heavy. It's based on how your customer feels. Because they've been massaged already earlier, so they're already a little bit more relaxed. So when we're doing it the second time, we can do it a little bit deeper. And also because they're relaxed right now, how do we know? Because from their chest, it's not tightened, it's not stressed, and you can see their facial expression is very relaxed. So even if we do it a little bit deeper right now, and we don't go too deep straight away, because it'll frighten them and it may even cause them to be very uncomfortable. See, we're pressing it down very, very deeply, and they still don't feel anything. They're not being tensed up. That means they're very relaxed right now. Okay, next you can ask them to lay back again. Now we're going to press on the upper edge of the pectoral major muscle. You can use your thumb to work on it lightly. So also light, medium, heavy. And you want to use your tip of your finger or the second section of your finger. Or if you're just trying to rub it, you can use the middle of your thumb to relax it. From the inside toward the outside. Make sure it's always from the inside toward the outside. It'll be clockwise. The second time, you can do it a little bit deeper. And then pick it. Relax it. Because here, I can see there's another knot here. And I can breathe in and then breathe out. If they have fallen asleep, you can watch their breathing. Okay, and breathe out. And then you really just have to work with your breathing. You can just observe their breathing if they have actually fallen asleep. Okay. And then press a little bit deeper. Relax their upper edge right here. And use your hand to help them relax a little more. After they've relaxed, start from the delts, the deltoid muscle. If you can see it, ask them to put their hand here, and then 1, 2, 3 points. 1 thumb, 2 thumbs, 3 thumbs. The second one, 2, 3 lines. Make sure you press on all 3 lines. This is the upper edge. It can relax your neck, and it's very important. Then you can breathe in, breathe out. Breathe in, breathe out. And make sure you're not just getting hung up on how many points I'm pressing on. The main thing is I'm pressing on this line. I've also noticed they have a knot here, so I want to press it a little bit harder. And then if they're falling asleep, I'm going to breathe in, breathe out, breathe in. Okay. Breathe out. And the second one. Breathe in. Breathe out. Press it down. The third one. Press it down lightly, slowly. And then finally, at the end, you want to smooth it out from the inside toward the outside. Then this next, the same pose here at the 10-2 point. Go down to 10 zhong. Rub it. Okay, so you can rub it like this. So also smooth their breathing out downwards this way. Once you're done smoothing it out, start from the left side and then smooth it out on the right side. Once you're done smoothing it out, start working on the neck. So on the neck, you want to push it up a little bit like this. So if you see any points that's extra sore on here, make sure you use your finger to push up this way on their sore points. And then use the other hand, use about 4 fingers, push it up like this. Use the weight of their head, not just your hand, but use the weight of your hand. Push it up. And then press it down for only 5 to 15 seconds, not too long. Okay. Push down on the feng qi. And then pull it backwards. And then press it. Pull it backwards. So you want to feel like you're kind of holding onto here on the feng qi. And then after you're done pulling it, you want to lay backwards. Make sure your body's laying backwards. And it doesn't have to be like too crazy, but use your body to pull it backwards. Okay, next you want to do where your 2 ears meet on top of your head. It's called Bai Hui. Go from here, go to the top and use the Bai Hui as the center point, and you can press it down lightly. Then you can press it on the front, back, left, right. So use this one as a middle, front, back, left, right. Then tap on it lightly, slowly. Then to the left, over here. And then tap it to the right. If you feel like it's kind of strange on the right and or it's not working very well, you can switch hands. And then the front. And then underneath. And then once you're done, kind of massage it a little bit like this. Just massage their head a little bit. Smooth it out. Massage it a little bit with the. You can use 4 fingers like this, or you can use your thumb like this. So once you're done, then you want to focus on the feng qi. Do it lightly 3 times. Okay? And then a little bit harder. Okay. And then you're doing it heavy. And just lean backwards. Use the momentum of your body. So use the weight of your body, not like you're just strengthen your hand. So this is our shots apart. Next, we're going to do the gua sha on them. So the first line is going to be from here, from right behind their skull, the indentation right here. Working down, we're going to do this here, and you can see when you press down from here, there'll be an indentation, and then we'll be scraping down along like this. And we'll stop right about the middle of the 2 shoulder blades. And then behind the neck, downwards. Behind the ears, downwards. Work on the trapezoid. And then you'll work on the other side. Scrape it downwards. Going down the other side of the trap. Again, in the beginning, because there's a line, use this as the main line. And then scrape downwards like this. So we talked about it in the beginning. So the most important acupoints here, when you lower your head, this is the dazhou point. The second one and the third one, around 2 fingers to the side, this is the fei shu spot. So 1, 2, 3. The fourth one, right here, 4 fingers. This is a gao huang point. So make sure you remember these points. Okay, so we're going to start scraping now. So when you're scraping, you can help them relax a little bit like this too. Get relaxed. So when you're performing a gua sha, you want to do it slowly and lightly. And because they have a lot of sha, they have a lot of build up right here, it has turned red straight away. So just do it lightly. So you can see it starting to show up. Then you can ask them, hey, how are you feeling? Is it feeling okay? Am I doing it too hard? Okay, so you can see it's starting to show up right here. You really don't have to do it too hard. You just have to do it lightly and repeatedly. The sha will show up straight away. You don't really have to do it hard. And you can see it starting to show slowly here. Okay, so you can see you only have to do it very lightly. You don't have to put them in a lot of pain. You can see here, it's a purple sha. You can see it right here. It's a little bit more severe. It's this purple sha. So it's a more severe sha. So when our circulation and the oxygen is not coming in very well, so we'll be lacking oxygen. When they're lacking oxygen, the color will be darker. So if they're really not lacking oxygen, then it will be pinker, but it'll get darker the more it's lacking oxygen. So you can see if it's really bad with circulation, you can see it would be purple, or even worse, it would be dark, even black. That'd be very scary. Okay, you can see it's starting to show up right here too. So you don't have to be in a hurry. So even if it's not showing up initially, when you do it slowly, it'll start showing up. So you can't rush when you're doing gua sha. Okay, as you can see, you don't really need to put a lot of force into it. You just need to do it slowly. You don't have to rush and be really hung up on trying to see the results straight away. You just have to do it slowly. Then you can see some result, light, even when you're doing it lightly. Next, we're going to work on the left. So when you're scraping it slowly, you'll start to see the result. So this is basically one line, two lines, and the third line is right here. And the other side will do the exact same. So right here. Okay, so our demonstration will end right here. Hello everyone. I'm teacher Lisa. Today we're going to talk about lymphatic draining massage. So why are we going to do lymphatic draining massage? What are some things we have to actually be cautious of? And we'll also demonstrate doing the lymphatic draining massage. These are the main things we're going to talk about today. So what is a lymphatic draining massage? A lymphatic draining massage is a massage to increase lymphatic circulation. It is usually a shallow massage technique, and you want to do it very lightly. So we're using the pushing force between the skin with the hands, promoting the contraction of the lymphatic vessels and directing the lymph to nearby functional lymphatic system parts, which helps elimination of lymphedema. So what are lymph and lymphatic circulations? So there are about 500 to 600 lymph nodes in the human body, which are spread all over the body. So lymphatic system is like another cardiovascular system. But lymph are responsible for reclaiming excess water and bringing it back to our heart and immune system. If bacteria or virus enter the lymphocytes in the lymph node will filter and guard the body against the pathogens. And this is why when we're sick, we'll feel a slight swelling in our lymphatic areas when you get sick. You can feel a little bit of swelling. So make sure you do not get a massage when you're sick because your body is fighting against the bacteria or the virus. So lymphocytes are an immunal cell. So they will help detoxify the pathogen and assist the blood vessels in transporting metabolites. So in the picture, you can see there are three main lymph gathering nodes. So there are the cervical, the axillary, and the groin lymph node. So this is a lymphatic system and distribution diagram. So we talked about lymph is an auxiliary effect on blood vessels. When the metabolites between the tissues cannot be reabsorbed by the capillaries, they can be absorbed by the capillary lymph ducts. So what is the primary lymphoid organs? It's including the thymus and bone marrow, where the lymphocytes mature, and eventually it'll merge with the veins. So here's a distribution diagram. So we're going to talk, this is the left, this is the right, we'll talk about the left. The lymph in the left half of the body, it'll go from your foot to your intestine to your waist, and then collect in the cisterna chili between your upper abdomen and the belly button. And the lymph flows back to the chest duct. So they will all flow back here. You can see the picture here. You'll go to the chest duct. And the chest duct is the largest lymphatic vessel in the body, and then injected into your left subclavian vein. So it is the left internal inferior jugular vein. And this way, the lymph will return to the blood. So this is how it works on the right side. So on the right side, it will start from our armpit. It will go to the right side and then inject it into the right subclavian vein, and then it'll go right back into the blood. So it doesn't matter on the left or the right in the end. They are both injected into the superior vena cava and then return to the heart. So this is how our lymph circulation. It starts from your leg to your intestine, to your waist, and then to your chest duct, to your left subclavian vein, and on the right lymphatic vessel, and injected to the right subclavian vein. So this is how it goes. Okay, so what are some of the precautions we have to have for the lymphatic drainage massage? So if you have a heart disease, wound on the skin, or inflammatory symptoms such as redness, swelling, heat pain, cancer metastasis, and explained pain and blood clots, make sure you do not do this massage because it'll accelerate your sickness. Because when you're trying to do this, it will actually run through your lymph nodes, and especially cancer. Because for cancer, mainly, you can't have too much nutrition. So if you're trying to use the lymphatic draining massage and allow it to accelerate, it would actually make the cancer worse. Also, for the massage, you also need to make sure you need to do it lightly. Putting too much forces on the skin is harmful. It'll hurt the skin. So the massage should be conducted with a gentle hand. When your lymph nodes are swollen, that means your lymph nodes are fighting bacteria. So you need to make sure it is gone before you have the massage. So all you have to do is to lightly on the skin. Okay, so later we will do the back of the leg, a demonstration. And then next, we'll also show it on the foot. And then we'll do it on the butt. And then next, we'll do it on the back. And then the front of the leg. And then the stomach. And this will be the last part we actually work on. So that will be how we explain the lymphatic massage. Hello everyone. So today we're going to show you and demonstrate to you how we do the lymphatic draining massage. So first, we don't have to prepare a lot for the massage. The first one will be a nice and light massage oil, and we also need a 75% alcohol, dry cotton pads, and use an empty bowl. So, of course, before we touch anyone, we need to make sure we sanitize our hands. Make sure you have a garbage can. Make sure you have tissues too, and a towel. You need a dry towel. Because when we're using the massage oil, we'll have greasy hands, so we need to have a dry towel next to your cart. Okay, these are all we have to have for preparation tool-wise. So when we're demonstrated, we will start from the side of next to their leg. So we'll start from the right leg. And then it'll be the same to the left leg, and then we'll work on the butt, and then we'll work on the back. And then we'll ask our client to turn around, to flip, and then we'll work on the leg on the right hand side first. Sorry, the right leg first, and then you'll do the left leg, and then we'll work on the stomach, and that will be the order we're going to demonstrate. So we're going to start from our right leg. Okay. Okay. So here, make sure you cover the client properly. Open their leg a little bit. And this is how you fold the towel. Make sure you cover everything else on the customer for them. And this will be your preparation. Next, we're going to sanitize our hands first. Okay, so same, you'll do the palm of your hand, the back of your hand, between your fingers, the tip of your fingers, and your wrist. Then you'll sanitize your right hand. Okay, so the palm of your hand, the back of your hand, in between your fingers, tip of your fingers, your wrist. Okay, so when you're doing a body massage, your sanitizing will be a little bit more. First, you're going to sanitize your hand. Then you have to sanitize the customer's legs. So you have to actually clean their legs. So the way to clean their leg or their feet is the same. Wipe down their entire back of the foot. And you see there's a little wound. Okay, the back of the foot. Then you'll do it on the other leg. Do you have any wounds on this foot? Okay, so the same thing. Okay, so you need to finish this. And then you'll clean and sanitize it. So then we'll come back and sanitize our hands. So next, they'll finish our sanitizing process. So then we'll start massaging, starting from the right leg. So first, we're going to put the oil on first. You need to see how much area you're supposed to cover and take sufficient amount of massage oil. So first, you put the oil in first. So you can do it by dots, or you can use any way that you're familiar with. The main thing is you need to make sure the entire area that you're going to massage to be covered with oil. So this is basically smoothing out the oil. Then we're going to do the first soothing. In Japanese, it's called a flange. We need to do our smiling line. A smiling line is the bottom of the butt. The bottom edge of the butt. That's called the smiling line. Okay. When you come back, it can come back in a straight line. So we're going to do this again. Do it slowly. So we did talk about the lymphatic draining massage has to be light and gentle. And then one more time. Okay, so when you're doing the soothing, there's one action that's very important. So you can't just do it on the surface. You need to actually wrap everything. You have to see my hand. You have to actually wrap it around like this. When you're coming back, you need to wrap it around too. So one more time. What is wrapping it around? Okay. Next, where the Achilles heel is, the tendon, use both your hands, put them together, press it down a little bit, use the weight of your body and push forward. And then vibrate it 3 times. And then come back in the same posture and then do it one more time. So first, stop it there first. Use the weight of your body and then push forward. You can see your muscles and they're going up and down with our hands. Okay, I'm going to demonstrate one more time. You have to do it really slow. Okay, so right here, you have to go up a little bit and then go down again, all the way to the smiling line 3 times. And this is our second gesture. Then we'll use an outwards H shape. So the 4 points below the knees and then 4 points above the knees. First, you draw in shape like an 8. And the second spot. A third spot. And the fourth spot. And then your thigh. 1, 2, 3. So about 10 centimeters between your 2 fingers. So go down straight like this again. So we'll do this one more time. Draw an H shape. The first spot, the second spot, the third spot, the fourth spot. Use your thumb and then press it down. Make sure you don't press it like this. That would be very painful for the customer. Use the middle of your thumb. And then the top one, the first top one, 5, 6, 7, 8. Okay. And next, we're going to massage the bottom of the feet. So when you're massaging the bottom of the feet, use one hand. So this customer is a little bit taller. So what I need to do, I need to actually pull their foot up a little bit, because otherwise when I'm pressing down, it will hurt them. So draw an 8, starting from their heel on the bottom of their feet. Okay, I'm going to do it slowly. So draw an 8. To make sure you draw all 5 toes. And then go outwards. Take a line like an 8. Come back. Draw an 8. Go all 5 toes. Go on the outside. Then come back. This is very important. So you can see how I'm going this way. So draw another 8. So make sure you work on every single one and work on them slowly, not too fast, because there are height differences on the bottom of our foot. So if you go too fast, you won't be able to hit all the spots. So you see, as you can see, when I do it slowly, and you press all the different spots. Okay, so this is us drawing the bottom of our foot in an H shape. And then do this. You can see our hands. Okay, so you can see over here, you're still using this part, and then you're coming back. On the edge, you're still using here. And draw an 8 back. Not here, because you have no strength over here. So this is where I'm using. So use every single knuckle that you have. I'm going to do this one more time. Because the skin on the bottom of our feet are a little bit thicker, so we're using our knuckles. And there's a lot of acupuncture points on the bottom of our foot. And because there are a lot of organs that works with the acupuncture points of our foot, so you want to work on it. Okay, so that's the bottom of the feet. So next, once we're done with the bottom of the feet, we want to soothe it. So use the 2 knuckles. 1, 2, 3, because it's a straight, because we're trying to do it in a curved way, which then pull on, we'll be pressing down on their foot. It'll be uncomfortable, but because this is straight, you don't have to pick their foot up. Go all the way to the bottom of the foot. And then all the way to all 5 of their toes. Go up and down. Okay, same. Right here. You see my hand? Go down. So, however many times you're supposed to do it, it'll be based on the lesson that you designed. So make sure it is just sliding and slowly. And make sure you pay attention to the breathing, both of your own breathing and your customer's breathing. So once we're done, you want to pick up the customer's foot. And then we'll be sitting right next to their leg. And then we'll put their toes on our shoulder. And then make sure it's secure. So our body will be a 90-degree angle with their leg and our body. Because if it's the wrong angle, their legs will actually move along with it. So you want to actually make sure it's at the right angle. Then you use the 4 fingers, the top in the middle. The same thing. 4 fingers. So usually, sometimes a mistake people make, you'll start opening up slowly. So when you're moving along, this is going to be basically the opening of your hand right here, and you need to work on the side as the side of the customer's leg, but it has to stay in the middle like this. So if you're actually going along the curve of their leg, it'll start opening up. So take a look right here. This is the difference. Because we need to make sure there's a point right in the middle of their calf, and we need to put our hand right down the middle of the calf with a little bit of pressure. So usually for the customers who have standing for long periods of time every day, it'll be very sore for them. So make sure you don't open up. One more time. When you're going down and up again, you make sure you put a little bit of force into it too. So open your hand and using the ball of our hand, and can you see their calf has been pushed up? You see that? And then go down, and then when you go back, the parts you squeezed will be pushed out, will bulge up a little bit. Okay, so why do we say we have to put their foot on our shoulder? Because it'll make a huge difference on the next action we're going to do. So when you're doing this, make sure you're making it quiet. If you're doing it like this, it will be very sturdy. So remember, when you're doing this, you can't make it too loud because we're trying to allow their fat to burn and we're rubbing on it. So we're going to move upwards from the bottom to the top. Okay, now that you're done, use your left hand, hook on their toes, and then pull it downwards. So it is actually supported. So if you push it down like this, you'll hurt them. So you want to wrap their toes first and then push it downwards. And there's a Yongchen point. It's right in between, about 1/3. Knock on it 6 times. And then do it one more time. It should sound like this. Can it sound like this? No. So it needs to be rhythmic. 1, 2, 3, 4, 5, 6. So when you're tapping on it or knocking on it, you need to hold on to it and then hold it, push down. Your foot should be straight. Make sure it's not shaking. Okay, next. Use one of your hands on their Achilles heels and use the other hand to push on their foot. We're trying to make sure our customers don't get hurt. It's kind of like stretching. The same. Okay, so can you see my other hand has been holding it down the entire time? Make sure it is held in place. This way, it'll be done to the best. Okay, after you've done it a few times, you can see how sore or how uncomfortable they are. Also, based on how long your class has been designed to go on. Okay, next. You can't let go of your hand. If you let go of your hand, their legs will fall. So you want to put it down lightly. And then we're going to release the toxin. Look at my right hand. Wrap their foot up. Use their left hand. And then hold on to their Achilles heel. Use the weight of your body and pull backwards. Pull backwards. Can you see my body is pulling backwards? Yeah, one more time. Use your right hand. Hold on to their entire foot. Use your left hand and keep it in place. And then pull it backwards. Make sure your hand is holding on to it. You need to actually hold on to it and then pull it backwards. Okay. Now, what we have just done with the relaxation, now that it's done, what we're going to do is knocking and patting. Once their muscle is relaxed, all the lactic acid will come up to the top or the skin. So you'll try to release lactic acid through knocking and patting. And you need to practice this. So use your hand, use this part of your hand, not here. It'll be very heavy. You have to use this part. Because if you use this bottom half, it'll be very painful. So can you tell the difference in the sound? Okay. And this? So this is the kind of sound we want. So where do you start from? Start from the inside. So squat down a little bit. And then don't hit this spot. And then do it on the butt as well. So right now they shouldn't be in pain. So this is knocking. So you have to finish where you started. And then when you're going to pat, it's going to be the same. So when you're patting, first flip your hands and then cup it. Put your thumb here, outwards like this. And then cup your hands. Once you're ready, flip it over. So it should sound like a horse. It sounds like horse hoofs, right? So you need to be a happy, a light horse, running very fast, not a war horse. The same. You will finish where you started. I'm going to show you one more time. Not like this. This is what we want. Okay, squat up and down with your body. Up and down. As long as your posture is right, you won't get hurt very easily. Finish where you started. Next is drawing an 8. A full 8. Okay, same thing. Wrap it up and then go down in a straight line and do it again. Do an 8. Do it lightly. And do it one more time. Okay, so do it the same way. Put your thumbs together, use the other 4 fingers, and make sure they're actually wrapped around, and then soothe it. So that will be our legs, lymphatic releasing massage done. So we'll use the same speed, same order, and we'll do the left foot, left leg. So this will be the demonstration for our legs. So next, we're going to show you on the butt. So first, we're going to put our towel to where what we mentioned is called the smiling line. And put the towel up here, cover it too. Then you have to smooth on the massage oil. Take the sufficient amount of massage oil, and then we're going to do it like this. Smooth it on like this. And then your tailbone right here. Do a little bit on the side, and then make it pointy up here. This is the first action. Smoothing on the oil. And then we're going to do all the rest of the parts here, the 3 points. And then 1, 2, 3. Chop, 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 going inwards. 1, 2, 3. So first we're going to smooth on the oil. The first spot over here. And then do this part. So 1, 2, 3, going it diagonally. 1, 2, 3. So not flat. you're doing a diagonal line. 1, 2, 3. 1, 2, 3. 1, 2, 3. One more time. 1, 2, 3. Okay. So this is a second. Then you're going to kind of pick it. So pick it across from you. This is similar to when we're doing a slimming massage. So for females, they'll have a little bit more over here. So you want to go this way. So then do it diagonally. So going straight first. You need to put a little bit of strength into it. Use your body. And go diagonally. After you do that, you have to lift their bum. So where are they lifting the bum? It's where the smiling line is. One more time. Do it diagonally. Okay, start. Okay, and then here, once you're done, the same way we want to go and start knocking and patting. The same, start from the outside. And then make sure you don't use the back of your hand because it's going to hurt if you use that. So when you're massaging, if you do any very harsh abrasion, you need to knock and pat. Okay, so how do we end this? Same. Okay, so this half is done. So remember, when you're doing the other half, do not take your hands off the customer. This is a feel of security. So we'll do the other side. We'll do the same. We're going to pick. You're going to pick like this, diagonally like this. And then go straight again. Use the strength of your body. You need to put a little of strength into it. You need to pull it upwards. Lift the butt up. Okay, so you'll notice that their butt is being lifted upwards. If you're doing this correctly, then you can lift the butt. Next, you're going to knock. The same thing. It can't be too hard. So the same. This is where you finish. So when we're testing, I will be knocking and I will be judging it based on what sound it's making. So it has to be light. It has to be very fast and light. It should sound like this. Okay, now on the left and right side, then we'll go back and try to apply more oil. Okay, so that should finish the butt. Next, what we're going to demonstrate is going to be the entire back. There will be 6 different steps to doing the back. So when you're applying the oil, depending on how big the area is, you can decide how many oil you're going to put on. And also, you can do it in 2 applications. Okay, you can do it in 2 different applications. The second application, you can focus on the parts that wasn't enough earlier. Okay, so put plenty of oil on. So we'll do the first thing, what's called a flange. Okay, so when you're doing a flange, just close and open. Close, open. And then we will pull on the shoulder. So we'll pull on these muscles. And you can come back and then close up, open, close, open, close, open, close, open. Okay, we'll do it one more time. We'll do the flange. Okay, remember, we can't put a lot of pressure into any of the things we're doing. Put it down lightly. Your neck and your shoulder. Work on these muscles. So you can do it as many times as you need or want. It will really depend on how tired your customer is. So this will be a flange and the oil application. Also, we're going to draw an 8 right now. So we're going to draw it on the chest. So there's 4 on the bottom and 4 on the top. So draw 8. And this is the bladder meridian. Also about 10 centimeters. Rub it a little bit. 2, 3, 4, 5, 6, 7, 8. And then you'll start going downwards through rubbing. And then we're going to do this one more time. 8. 8 different points. Use the middle of your finger. 2, 3, 4, 5, 6. If anyone who have a lot of pressure on their chest, it may be a little bit more puffy over here. 7, 8. Same thing. Spin it a little bit, going down. Next, we'll use our hand. Make a fist. Next, when we're doing the bottom of the feet, we're using our knuckle. Now we're using right here. So do the 8 points. So do the bladder meridian. So go down. Use your left hand to support it, so it wouldn't be so harsh. So do a light spinning, and you'll see a mark when I come back up. You see the mark? So you can work on these 8 spots. A second spot. Make sure you can't use it right here, so because it will hurt if we use this part. 3. So the 8 points are the 4 points on the left and 4 points on the right. So you can see the track marks right here. Make sure you start from the side. So 1, 2, 3, not in this direction. 5. Can you see the track mark? 6. 7. 8. 1. 2. 3. 4. Okay. 5. Make sure you're not hitting the dazhui. Just the bladder meridian on the 2 sides. 6. So, for instance, you can tell sometimes he have chest congestion. 7. 8. And he doesn't have the best of his digestion. He eats a little bit too fast. 1, 2, 3, 4, 5, 6. So you can see it's going down a little bit already. 7, 8. Okay, so now that you're done with these, you need to start to do the knock and pat. So for the back, you need to make sure you don't actually hit any bones or the spine. So skip here, skip here. So start from somewhere that's across from you. Start from the outside and make sure you squat properly. Remember, when you're knocking, sometimes you will have a blind spot. So you need to actually do everything, not just there. So here you can do a straight line. Okay, squat a little bit. You need to pay extra attention on the two sides. So when I'm looking at my students looking at my students but performing a massage, one of the main points I see is their coverage. I will pay attention to if they're missing any spots. So with your hands, if you're not used to it, hold it like this and then cup it downwards. Same. You can't only do it like this. You need to actually cover every spot and check with your eyes. And now it is okay if you hit the spine a little bit while you're performing this stage. Okay. So this will finish the petting. And the last thing we do again is a flange again and oil application. So sometimes when you're doing this, it'll turn into something like this, going outwards like this. So when you're pushing it outward, it should be like this, not like this, not like that. But you should pull it outwards like this and then come back. Okay, it's the same. Together, open, 90 degrees. So you make sure you actually wrap it. Okay, this is our demonstration of a lymphatic draining massage. Now we are going to demonstrate the front of the leg, and it will be the leg that is the furthest from the heart. The same. We're going to grab the massage oil and grab the proper amount of massage oil based on the size of the area. So you can tap a little bit and then smooth it out. Start from the back of their legs. If it's not enough, you can apply it twice. Okay, so that will finish our oil application. Next, we're going to perform the flange. So make sure you wrap the two sides on the outside. You can do a bigger area or a smaller area like this. So what's a bigger area? So you can do it like this. What is big? You can do it like this. And small is like a smaller area like this. So remember, it's very important to make them feel like both sides are wrapped up. Okay, next, we're going to massage the 5 toes. Use your thumb, the second one, to hold on to the foot. And then going from bottom to the top, in a spiral way, do a massage. Okay, do it on the small area. Don't do this. Do it lightly. So the curve that you're massaging cannot be wider than the width over here. And then you can press on the front a little bit first. Don't do this. That's very rude. So again, within the width, do a little spiral and then go on where the nail is, the second toe. Press it lightly. Give it a little bit of stimulation. It has a lot to do with our eyes. And the next, it's getting narrower. So when we're learning how to perform a massage, it is all about how detailed we are, and this is about how you can retain your customers. Over here, lightly, and it's getting narrower. 2, 3, 4. The fourth one, small spiral, a little all the way to the nail. Make sure you give it a little stimulation. You see here? Using a little bit of strength, give it a little bit of stimulation. And this is the last one right here. It's even shorter. Same way. Okay. So now you can work on the thumb and give it a little stimulation. The second one. Okay. These are all slow motion. The third one. In the back, you don't have to do a spiral. You just need to make sure it is sturdy, it is like held in place. But you have to do the spiral up front. So you only have to hold the back down and then do the spiral up front. Do a little bit of spinning, spiral. Push it down. Fourth one. Same. Push it down. Can you see the blood flowing, rushing here a little bit? Press it down, give it a little stimulation. Okay. You see the white here? So this is our toenails. Then next, we're going to apply a little bit more oil. And we're going to do the knock and the pat. So in the front, because there are bones, we'll do a little bit less. But when you're knocking, make sure, start from the thigh, and then don't do the calf. So how do you continue? So once you're done here, you go straight here. Knock. Make sure you pay attention to the blind points. Make sure you squat very low. So once you're done here, next, we're going to slide downwards. So we're going to say this one more time. So use your 5 toes all the way to the knees, and then go from the inside and start knocking. Starting the inside, do it lightly. In the beginning, we would recommend that you just knock on it very lightly. Not like that. They sound different. So once you get here, slide downwards. So the next is same as the last hand gesture here. Full 8 shapes. So when you do the full 8, start from the inside, going straight down. Full 8 figures. Okay, we're going to do this one last time. Okay. So we will smooth out their qi. So this is the demonstration for the front of the leg. Okay, this is the last one we're going to demonstrate is for the stomach. So for stomach, you would like to ask your customer to hold onto their chest and then put a towel on top of their hand. On the bottom, put the towel right under their belly button, about 3 to 4 fingers under the belly button. This will be the part we're going to demonstrate. So about 4 fingers. And on top, put their hand right here. Okay, so let's look at the hand over here. Okay, so this way it'll be more comfortable for them, and it wouldn't get in our way either. So we're going to start applying the oil. There are 6 different hand gestures for the stomach. So when you're applying the oil, once should be plenty. Okay, so our first action, similar to what we did with the leg, this is also how you do a slimming massage. If they have a harder fat, when you're doing this, it is going to hurt a little bit, but remember, you don't want to actually pull on their skin. You actually want to pull on their muscle. So this is the skin, this is the muscle. So use the weight of your body. So for instance, this customer is pretty sturdy. So they have very firm muscles. It seems like they're actually working out. So then you'll start to pinch. Can you see a little rectangular area here? Avoid the bones. This is where we're working on. This is a bone. We're working on here. So we'll start from here. And then work on the side of the waist, not up here. We'll have a blind spot sometimes, so we need to move our body over here. It is very, very important to pull on this part. go from the bottom toward the top. After you pinch it and work on it, soothe it. Soothe it 3 times. And then with this hand, you want to go where you were standing by earlier. Only from the bottom toward the top. Soothe it. So every time after you pinch it and rub it, you need to do the smoothing at least 3 times. Do it lightly. One more time. Okay, so next we're going to switch sides. We're going to work on this side. And again, do not leave the customer's body. So try to use the same gesture. First you pick it. So basically, however many times you're going to do it, it'll depend on if their muscles and fat are starting to soften up, or you can do it a little bit faster. So once you're done, if you feel like their body temperature is going a little bit higher, you can start working on it, pinching it a little bit. The same. And then soothe it the second time. Third time. And one more time. Once. Twice. 3 times. Okay. Next, we're going to try to do a little chop. We're going to basically work from the right side of the stomach and work along the direction of your intestines and stomach works. So put your hand down. Use your other hand to help it, to assist it. Avoid these bones on the 2 sides. On top of the bone, can you see there's a bone here? So on top of the bone, this is where we're going to do a little bit of chopping. So you're going to use your hand to make a round and then push. Avoid the belly button. So again, put your hand and then ask the client to breathe in and out based on the tempo. And then over here, you want to push it upwards. So you can feel from here, this customer has a lot of poop inside still. It seems like their intestine isn't working the way it's supposed to be. So we're going to try to soften it up. So now you can press on it a few more times. Working with the tempo of their breathing. Breathe in, breathe out. Breathe in. Breathe out 7 times each. Breathe in. Breathe out. Breathe in. Breathe out. And now I'll do it a few more times. Okay. So now that this is done, you can do a little bit of Tai Chi. So you'll try to help them soothe it. Okay, next, we're going to press on 7 different spots. Starting using the belly button as a center. The first spot is 1 finger down, and the second one is the second spot, and then there will be a 7 o'clock on the clock. They have to be 2 fingers wide. The first one is right here where the 1 finger is, and then another one is the second spot. The third one is about at the 7 o'clock, 11 o'clock, 1 o'clock, 3 o'clock, 5 o'clock. So what do? Use your middle finger and you try to create a vibration. So make sure you clip your fingernails and keep them clean before you do any procedure on your customer. So the first finger, create a little bit of vibration. Second finger. And then the 7 o'clock. Okay, 11 o'clock. 1 o'clock. 3 o'clock. 5 o'clock. So the direction you're creating the vibration, it'll be like this. And it'll always be like this. So can you see? It's similar to when we're trying to dig into a dirt. So you need to make sure this hand is actually vibrating. So my other hand isn't working. We're using this hand to create the vibration. A quick vibration, a fast vibration, like this. So at 7 o'clock, the direction, the 1 finger, first spot, second finger, 7 o'clock, 11 o'clock, 1 o'clock, 3 o'clock, 5 o'clock. So these are the 7 spots going clockwise to create a vibration. The last thing is we're going to do a flange to smooth out, to soothe. Okay, finally, ending right here. So this will be our demonstration for our stomach.